I'm Stephanie McKendry, an Academic Development Tutor in the school's Learning Development Centre. This short vidcast will talk you through what is expected of third year students and the need to be a critical thinker. I will also talk through the assessment guidelines for the module. One of the best ways to understand the step up expected from you is to look at the assessment matrices. These are what your markers use when reading your work. They tell you exactly what is expected of a good essay, an excellent essay, a fail, and so on. It's worth comparing the matrix for this year with the one from last year. What are the key differences? You can also look at the learning outcomes to understand what's expected of you. These detail everything you should be able to do and everything you should know by the end of the module. They're available within the first few pages of your module handbook. Learning outcomes are a great checklist to see your progress for assessments and revision. Are you demonstrating this knowledge in your essay? Could you answer questions on all of these topics in an exam? It's worth noting the language used in these learning outcomes. Again, they suggest the step up required. So you're asked to explore, analyse, evaluate. That's a lot more complex than simply understanding or describing issues. Would it be enough to give definitions of leadership theories and provide examples of how they enhance safe and effective care? This would probably have been sufficient in lower years of study, but not for third year. So what should you do instead? It's vital you take a critical approach to all of the module content. Obviously, you still have to understand and describe the theories, but then you need to move on to discuss why they might enhance care. How do we know this? Where's the evidence? Is it credible? What are the implications for nursing practice? As well as the need for a critical approach, you will be using a greater variety of literature than before. So it's important that you develop your library skills. There's plenty of support within the university to help you do this. You will also need to have a clear writing style so that you can move away from descriptive writing. Compare this example of writing to the one on the next slide. Here, the author simply presents relevant research, whereas this piece of writing considers a number of viewpoints, then attempts to discuss the evidence that supports them. The upcoming assessment for this module asks similar things of you. Make sure you spend time figuring out exactly what is being asked. You have to critically examine, so find differing viewpoints, consider the evidence, discuss strengths and limitations, ask lots of questions. Note that you're asked to consider contemporary literature, so you must make sure you're accessing up-to-date sources. You also need to discuss how, why, and in what ways the topic contributes to the quality of patient-centred care. And finally, remember that you should relate all of your discussion to your specific field of nursing. A very broad structure for your essay is provided in the module handbook. As you have a greater word count in Year 3, and you're discussing more complex issues, it is vital you think about your reader and take care structuring your argument. Think about any definitions or explanations that need to be provided within the introduction. Set the scene and make clear to the reader what they can expect in the rest of your essay. Justify your choice of topic. Why does it matter? To your field of nursing, to healthcare, to the NHS, to society. The main body will be where you discuss the issues that have emerged from the literature. You're also expected to make recommendations for practice. Make sure you can justify these, provide evidence to support them, and discuss any potential barriers to implementation. Then, finish the essay with a conclusion that summarises the main points. If you feel you require any support developing the skills needed for third year study, please get in touch with the school's Learning Development Centre. We offer workshops, one-to-one appointments and online materials, and we will be glad to help.